Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Today, Brad, we're going to talk about how to rehab after meniscus surgery.
Right.
And this is for Jim.
Jim, absolutely.
Hi, Jim.
He just had a meniscus surgery, rehabbing right now, and we're going to help him out how to follow through with this.
As we will help out anybody else who is new to our channel, by the
Sure
way. And
enough.
if you are new, please take a second to subscribe to us. We have a subscription button, maybe over here, maybe here. We provide videos how to stay healthy, fit, pain-free, and we upload every day.
Say no more. Okay, now this is a type of surgery. It's typically you go in one day, they do some debriding, the meniscus maybe tore or have a flap that's up on it. One way or another, it's a simple surgery nowadays.
Debriding, they're cutting a part of it away.
Right,
Maybe
exactly.
trimming it out, might have folded over, and it's causing your knee to lock up.
Exactly, just getting some of the rough edges off to smooth it up. And so the rehab is not real complex. It doesn't need a lot of therapy oftentimes, but it is important to get started on the right track.
A lot of it you could do on your own. Is what
Exactly.
you're saying, right?
The first couple, 3 days, this is pretty simple. It's the price theory,
Sure.
or theory, method.
Right.
Let's go through this quickly, Bob. You don't have to have one of these wedges, but it helps keep the swelling down, and it's very comfortable. Why don't you put both legs on there,
Okay.
Bob? That'll help so you don't irritate your back. Get a cold pack. Here we got a nice one here, but you can make your own. We've got some videos on how to make your own for very
So rest,
little
ice, compression, elevation. What's the
right.
P again?
Protect.
Oh, protect. Okay.
P-R-I-C-E, protect it. In other words, you may need to use crutches, possibly. Depends.
Sure.
Now, once again, all this depends on what your surgeon gives precautions. Every surgery is a
Sure.
little bit different, so you need to follow what they say first. If they say weight bearing as tolerated, range of motion as tolerated, you can follow everything we're
Right.
doing here. And as tolerated means if you get sharp pains with it, that's not tolerated. Little pain, little stretching pain, that's okay. Use good judgment, don't overdo it.
Yeah, listen to your doctor.
Exactly.
Like you said, they're all different. They all have their different ideas.
Right.
So-
So if they give those instructions as tolerated, here's how we're going to start. Now, later on in the program, as you rehab this and your knee gets sore because you decided to overdo it, you thought, well, I'll see if it makes it through this pain. Then you need to come back and do the price again. Elevate,
Right.
rest, ice. Okay. Now, Bob, why don't you lay down again? Let's go right
Sure.
on. One of the big things about rehabbing a knee, whether it's this surgery, an ACL surgery, is we need to get the quadriceps fired up.
Right.
We need to get those muscles working again because they're so important for walking. And so what we're going to do, can you grab the blue? We're going to use this half roller here because it works really nice, but you can put anything under your knee. Okay, what I want you to think about doing is squishing. If you got a little Nerf ball under your knee, that works good. You see, Bob is squishing down, and what he's thinking about, and I like to see the patella move upwards. He's got his pants on, so he can't, but if you have a pair of shorts on, in the clinic, that's what I'm always looking for. And then you can see the quadricep muscles tightening. Oh, yeah, look at those. Go ahead, Bob. Oh, they're just bulging right now.
I bet you they
can
are.
see it.
Yeah.
Okay, now the next thing, if that starts working good, this is going to be hard to see, but let's go like this. If you can put a ball under your knee or something like this, now think about pushing down on that. There you go.
And lifting up.
Yep, a short arc quad, we call that. And we're going to do sets of 10 of these. Once you get the squishing and the kneecap going up, then you can put the ball under here, do 10 of those, a couple sets if you'd like to, even 3 sets if you're feeling really good. Okay?
I'm feeling really good, Brad.
Yeah, all right. Now the next set. Weight bearing as tolerated. So why don't we do some exercises?
Did you want to do straight leg raises or not? Yeah.
Oh, yeah, we might as well
Okay.
do those while we're here. Thanks.
Yeah. So just, bending this knee usually, so
Right.
the non-involved leg.
Right, get the opposite leg up like this. It makes it
And
a lot
then-
easier on your back and the whole
Now you're going to
chain.
need to have a fair amount of strength to get to this point. I mean, you're going to have been doing the quad sets and the short arc quads
Right.
before you can start lifting the leg here.
And one thing you'll hear, if you hear a term saying a quad leg, that means when you do this, that knee is unable to
Yeah.
get fully straight, and that's a quad leg. If you lift up and you can't get a full extension, that's normal. But the whole deal is to get away from the quad leg, then you know you got an adequate
Right. Don't
quad
be lifting
strength.
like this
Yep.
and doing these. Get it out straight.
Right.
So.
Okay,
All right.
Good job.
Where we at, Brad?
next, weight bearing, okay? If you can weight bear, you've got some range of motion. We're going to get into some more range of motion right after this. But half squats. So we're not going to do squats way down like this. It's going to hurt. It's going to be not appropriate and just flare it up. So go behind a chair or a cupboard, and you're just going to gently squat. And we're not going down like this because we're not working the back and the hips. We want to keep that good tall posture. And you go down as far as tolerated. If you get down to here and it starts, hurting, a little sharp pain, this is all you're going to do for now. But if you can get down a little farther, right to here, and that's all the farther we're going to go for right now within the first 10 days of surgery, as long as it doesn't create any unusual
And they've done
pain.
studies on this, Brad, where you're really not putting hardly any stress on the meniscus when you only do I don't remember what the degree is, less than 45 or
Right,
something like that.
and that's why we're, it's a good point. That's why we call it a half a squat. A full
Because
squat
you're not
is
putting
90.
any stress on the surgical site, or, where you had debriding going on and such, so.
Exactly.
So,
And the next thing, here, Bob, why don't you take this chair,
all right.
is get the range of motion going. So if you want to stay up with the times, it's nice to get a device like this.
It just happened that we invented this too, by the way.
Right, yeah. And
The knee glide.
it works really well. You can put a towel down on the floor and just scrub the floor, which works reasonably well. But on carpet, it doesn't. So this device works well on anything. And
So I'm showing the flat version.
right, so as you start out, okay, go ahead. And you can see it works really nice. And the nice thing about this looks a lot easier. After a knee meniscus surgery, pulling it back like this is not going to be so easy the first few days.
This looks easy because I haven't had surgery.
Right. But we want to get it to bend more. If you can go this far and it feels fine, you may have to slide the device in a little bit, but you want to get your foot under the chair and you get some good bend or range of motion on there. Again, it's as tolerated. If you're getting sharp pain, you do not want to do it that far yet. Wait till the next day and the next day. It'll get farther a little bit every day. If you're having problems with that, the nice thing about this device, the knee glide, is you can put it at an angle and go downhill, and it actually makes it a little bit easier.
Right.
Yep, and it changes the resistance.
A lot easier rolling a ball downhill, isn't it?
Exactly. On the other hand, when you start getting stronger on the flat, you can do that for a couple minutes. You're pulling it under farther. You simply, exactly what Bob did, and I'm going to do, put it in the opposite direction, and you'll be amazed at what this little incline will do.
Now you're working a lot harder.
Hamstrings,
Hamstrings,
and that's a critical muscle to strengthen after any knee surgery. So work this, and even with a healthy knee, you do this for a couple minutes, and you feel those hamstrings working.
Surprisingly, you do.
It is. It is really amazing.
Yeah.
So there you go. Knee Glide sold by OPTP. They're the only people that sell it.
Yeah, I'll put the link down below.
Good. Once you gain your full range of motion.
Nice handle, by the way.
Absolutely. It's a beautiful device.
Pat ourselves on the back.
Yeah, we really did invent it. It's patented. Okay, let's go to the next one. Once you get full range of motion, and Bob, let me just demonstrate. Okay. Right here. This is the other nice thing about it. I did want to mention this early on. You can go like this.
Oh, sure.
And this is one that a lot of therapists and doctors will have you do in bed right away. This is a lot better than dragging your heel across the bed.
Right.
That's
exactly.
for sure. Okay. So, but once you get it up and you can pull your knee, as soon as Bob gets out of the way there, like this, you can go up like this and you can gently bring your knee. Full range of motion is this, assuming it was that way before surgery. But you're not going to grab your knee and pull like this right anytime unless it's pain-free. You can gently bring it up, gently bring it here, and that would be full range of motion, like your opposite leg, assuming this is a healthy knee. And again, make sure you can go fully straight. So fully straight, full flexion, we got full range of motion.
Were you going to do hip abduction and adduction on the bed right away?
Sure,
too?
that's a good idea, Bob.
So now you can start strengthening some of the other muscles, some of the other muscles that are on the side and on the inside of the knee.
Right.
So
you know, we're working on the hip now because even though it's a knee injury, the hip abductors almost always get weakened and it causes a limp.
And you have the IT band going across the knee, so you're getting some strengthening.
Yep, a good point. So the hip abductors connect to the IT band, which goes to the opposite knee and is a lateral support. So when you do this, make sure your toe is here, not like this. the body naturally wants to do this because it's easier. And like anything, we go for the easiest route. It's kind of like water as it flows down the hill. It takes the easiest route.
So stop doing it the wrong way.
Ah, thank you. Wow. See?
Yeah,
As therapists,
pretty
it
good.
drives you nuts, doesn't it,
Yeah.
Bob?
All
And
right.
then you want to get the adductor. You have to turn on this side, get this leg out of the way.
And then you're lifting up like that.
Yeah, this one is kind of an
A
awkward
little
motion.
awkward, but it's a good one to do.
You can tell by my grunting, it's not easy. All right. And now this is a nice one to do. Important, particularly to get your legs stronger for going up and down steps, is you can go up, you can have a stool like this, a 6-inch
go to a
stool.
step.
You can go right to a step, and if there's a handrail right there, you can hold on to it for balance. And line up everything and go straight up and straight
So
down.
this is the knee that had operated on.
Right, so this is my surgical knee, and this is going to happen, more than a couple weeks after surgery, more than likely. And up and down, and I want to see if, Bob, you want to hold that there?
Sure.
Okay. Do not let your knee go past this line. Okay, so see,
This line is lined up at the front of his foot.
Yep.
So you don't want the knee to go past the line
Right.
when you're doing these.
think about hanging a plumb bob down there. Jim will like that.
And that's with
Then we
all
go
the
down to
squats,
here.
with the wall squats too. With the ball,
Exactly,
you're gonna
exactly.
keep that.
Sure.
So
Okay. And you can do about 10 of those. You probably won't be able to do 10 right away, especially if you use good posture like I was doing.
you want to do some ball?
Yeah, let's finish up with the ball on the wall. All right. If you have a slippery wall, like a varnished door,
Yeah.
you can go on that and just slide up and down the door.
Same thing. Try to not let the knee pass the foot.
Yep, no good. That's going to
All right.
really cause that knee
Yeah.
problem.
Okay.
See how that catches on the wall?
Yeah, it doesn't work well.
Yeah, not desirable.
Ball on the wall works great.
Yep. Take the ball, put it on the wall. So it is the ball wall squats. Bring your feet out a little bit. Make sure your feet grip to the floor so you don't slip out, fall on your bottom side. Good posture. Down, not further than horizontal.
Right. And
And then
to start
back
off
up.
with, you can do shallow ones on this too.
Right. Why don't you throw me that cane, Bob? Because it's a really nice way to start. If you got a piece of furniture, a cane like this makes a big difference. So you have something to balance with if you're not used to it. And you can push up with it. It makes a big difference on this. So if this is my sore knee, no pain, remember. Go down if it starts to get pain. That's far enough, and just do half one or half squats as you get further and further along. Don't go this far down ever.
Right.
That's no good. Plus,
Don't need to.
right.
Why don't you show hamstring strengthening yet too, Brad?
Oh, good idea. Seeing how we're on a roll and we got the ball.
We got the ball. I think you really should do these too.
Yeah. Because this is more advanced hamstring. This is the next
Yeah.
step up from the knee glide. With the ball, you're laying on the floor, carpeted floor, and you're going to lift up your butt a little bit and roll it in, and you will feel the hamstring
You
work.
could start with the butt down even, couldn't
Yep.
you, Brad?
Yeah,
you're
you could do
and just push your heels into the ball.
Yeah, this is actually a good range of motion as well. Look at that knee.
Right. Yeah.
Yeah. The ball is a wonderful tool
I just
as
like pointing
well.
at things here, by the way.
Pardon me?
See the knee, how it's bending. I like pointing at things.
Oh, isn't that a nice pointer, Bob? Be careful with it, though. I
All
got to
right.
tell you.
Then go to.
I need my safety glasses.
You're gonna go to one.
Oh, yeah. Oh, yeah. This is it. Once you get to these and it's easy and you're feeling kind of cocky, then lift up one leg and then try it out and see what you can
Or you
do.
can cross over to start off with.
Right.
You don't want to be quite as hard.
Yeah.
I do it this way.
I thought I'd go right to the hard stuff, but yeah, it's a good point, Bob. This is not as hard as this. You could hear the grunting, and that means it's hard.
All right. Well, with that grunting, I think we'll bring this to an end.
Oh,
Thanks everybody for watching, and please subscribe if you
there
haven't
you
already.
go.